Hello, my name is Ruth Watson, and I am one of the practice educators based within the Southern Health and Social Care Trust for our Diagnostic Radiographers. Initially, you will have a decision between two types of radiography. Firstly, you've got diagnostic radiography. This involves undertaking a range of imaging procedures to obtain images from inside the body, and this can include imaging such as general X-ray, CT, MRI, nuclear medicine, ultrasound, interventional, DEXA, and mammography. The second choice is then therapeutic radiography. So this specialises in the planning, administration and aftercare of radiotherapy treatment, mainly for patients with cancer. Today I've been kindly joined by two of our new graduates, Aoife and Heather, who are going to give you a little insight into why they decided to carry out diagnostic radiography. And whilst they're talking, you'll be shown some images of a patient's journey through general imaging.
Hello, my name is Aoife and I am a diagnostic radiographer for the Southern Health and Social Care Trust. We are one of many careers that make up the group known as allied health professionals. You'll have heard of physiotherapists, occupational therapists, dietitians and so on, but not many people know about radiographers. I personally had no idea of our existence until I began my research into the profession. I, like many others, assumed nurses or doctors undertook x-rays, and now as a qualified radiographer myself, I can't understand how this is the case. I came across radiography by accident. I knew I wanted a medical career that wasn't a nurse or a doctor, and after flicking through a prospectus that was given to me by a careers advisor at school, I found radiography. And then I found that there were two types, therapeutic and diagnostic. Without knowing properly what either was, I was instantly drawn towards diagnostic, and after some research, I decided it was going to be my focus. I completed a work experience day in the Belfast Trust in my 6th year of school, and I really enjoyed it. And after a brief trip to A&E myself following a car accident and meeting the loveliest radiographer, I filled in my UCAS for diagnostic radiography. As I knew I wanted a medical career, I had already chosen to study a science subject at A-level. I completed A-levels in chemistry, maths and history, and a biology AS level. I achieved 3 Bs along with a successful HPAT examination, which made me eligible for a place to study in Ulster University, Jordanstown. I studied there for 3 years and I am now 1 year qualified and out working in the Southern Trust. Every day as a radiographer is different, and I personally love that about our profession. It's one of the main things that drew me towards it. One day you could be x-raying a patient in A&E, and the next you could be up in theatre with them screening as their fracture is being healed.
Hi, my name is Heather and I am a diagnostic radiographer within the Southern Trust. I decided to undertake a degree in diagnostic radiography primarily to increase my earning potential. As a single mother, that is always a consideration when making any major decision. I was already an assistant working within the radiology department when I decided to go back to school, so I had a good understanding of what the job entailed. During my research into the program, I realized I needed to do something to satisfy the academic requirements of the course. I undertook an access course in science offered by the Southern Regional College, which provides the equivalent of 5 GCSEs and 3 A-levels. As it's underwritten by Ulster University, it's designed to prepare you for continued study at degree level. It's designed with mature students in mind and is therefore offered both full-time and part-time. I opted to do it part-time over 2 years, which allowed me to continue to work. Leaving full-time work after so long was a daunting prospect, especially with 2 children, a mortgage, and all the expenses that come with running a house. Luckily, in Northern Ireland, the fees for diagnostic radiography are still paid by the Department of Health, which took a lot of the pressure off. That, along with student loans, grants, and part-time work, made it possible. The course director and lecturers are very approachable and make every effort to accommodate parents and mature students. I have now been working within the NHS for a year and can honestly say that going back to school was one of the best decisions I have ever made. Each day in the department is a little different, and we get to work with many health professionals within the hospital. It's a very multidisciplinary approach to care. The vast majority of patients who come into ED or the hospital will see a radiographer at some stage. Helping patients when they are at their most vulnerable and taking images that allow quick and accurate diagnosis is very rewarding. If I could give one piece of advice to anyone considering a career in diagnostic radiography, it would be to go for it, whatever your age or circumstances.
So what is student life like then within the clinical placements? So most university courses are a mix of time within the university and then time out within the clinical setting. So this is an opportunity to build up the radiographic skills that you've been taught within the university. It also gives you the opportunity to build up your patient interaction, your teamwork and skills and communication skills. And during this time, you will have further training sessions within the clinical setting, either in the tutorial form or the practical sessions as well. And this is all set up to help support the academic work covered within the university. The radiography teams and educators are there to support and help you through this element of the course. We would like to thank you for taking the time to listen to our presentation, and we hope it has been some help in making your future career decisions. We wish you all the best with your future.